When should men get a digital rectal exam for prostate health? When it comes to prostate health, many men wonder about the role of a digital rectal exam, often referred to as a DRE. This exam involves a healthcare provider inserting a gloved, lubricated finger into the rectum to feel the prostate gland. The purpose is to check for any irregularities, such as bumps or hard areas that could indicate prostate cancer. Interestingly, prostate cancers often begin in the back part of the prostate, which is accessible during this exam. However, it is important to note that the DRE is generally less effective than the prostate-specific antigen blood test, commonly known as the PSA test, when it comes to detecting prostate cancer. That said, the DRE can sometimes identify cancers that the PSA test might miss. Current medical guidelines emphasize that prostate cancer screening should primarily rely on the PSA test rather than the DRE alone. The American Urological Association and other expert groups recommend that men at risk begin PSA testing between the ages of 45 and 50. This recommendation may vary based on individual risk factors, such as family history, race, and overall health. The DRE may be used alongside PSA testing to help assess the risk of clinically significant prostate cancer. However, it should not be the only screening method used. Men should engage in shared decision-making with their healthcare provider regarding prostate cancer screening. This conversation should take into account personal risk factors and preferences. For men who receive an abnormal PSA result, a DRE might be performed if it was not done initially. This can provide additional information before deciding on further testing, such as imaging or biopsy. It is also crucial to understand that routine screening using DRE without PSA testing is not recommended due to insufficient evidence of benefit. Additionally, routine prostate cancer screening, which includes both DRE and PSA testing, is generally not recommended for men over the age of 70 or those with limited life expectancy. In these cases, the potential harms of screening may outweigh the benefits. In summary, men at average risk should consider starting PSA-based prostate cancer screening between the ages of 45 and 50. The DRE can complement PSA testing but should not be used as the sole screening tool. Decisions about screening, including the use of DRE, should involve a discussion with a healthcare provider. Routine DRE screening without PSA testing is not advised, and screening is generally not recommended for older men or those with limited life expectancy. This approach aims to balance the early detection of prostate cancer while minimizing unnecessary procedures and potential harms, aligning with current scientific consensus and guidelines from major health authorities.